We had music. We never have music all day, so thank you guys for coming. I'm Lance Uchida with the Hawaii Fire Department. We're part of our multidisciplinary team put together by the mayor to help educate the community, the public about what's going on. Okay, so part of our multidisciplinary team, we have the Hawaii Fire Department, the Department of Health, we have the mayor's office. Okay, we also have the Civil Defense Agency and the Hilo Medical Center. Before we get into the formal part of our program, we're just going to start with introductions with the whole team.
Yoshi Otake from Hawaii State Department of Health.
Hi, Jason Dela Cruz, planner in the Office of Public Health Preparedness for the Department of Health.
Eric Honda with the Hawaii District Health Office.
Roy Takimoto, Mayor's Office.
Rebecca Carvalho.
Hi, good evening, Chris Honda with the Hawaii Fire Department EMS Bureau.
Evening, Vern Hara from Fire EMS. Good evening, Bobby Pereira from Fire.
Stacy Domingo, Hawaii Fire Department. Oh,
Rose Batista, Mayor's Office, and thank you all for coming.
And our most important person.
I'm the last. Baron Otani from the Mayor's Office. Thank you for coming.
Well, thank you. Thank you to Rose for coordinating. The mayor gave her a big assignment about contacting the home care providers. Obviously, that's a concern for us as far as making sure that we do outreach for your group. So she had the big task of contacting everybody, let the phone tree work, and then see if we can get as much care providers into this presentation as possible. So anyway, again, what we're here to do is talk to you guys about what's going on with COVID-19 outbreak. And I'm sure you guys are all paying attention. You guys are all watching the news. Okay. Did you notice something different about this training? You see people coming to this side. What was different about this training or outreach? Anybody? One entrance. There's a reason why we locked all the doors. And though it's not fire, we have firemen, so we know how to fire escape, but there is a reason why we did it like that. We wanted to guide you folks. So for you folks, the training started when we were outside already. Right? We wanted you guys to have the mindset or the thinking about we should be protecting our homes. We should be protecting our care facilities. We should be making sure that sick people don't come inside. Right? 3 simple questions that was asked. Are you sick? Okay. Do you have a cough or congestion? Do you have fever? Pretty simple. You guys can do that at your homes. You can protect your house. You can protect your clients. Right? We can do what we need to do as far as breaking this chain. Okay, so that's a good thing. Okay, so and then what did you guys do after that? We did the hand sanitizer, right? That's another big thing we're gonna talk about. So our training started when you guys walked through the complex already, and that was part of the thought process. Okay, so part of our theme too is that this is a community issue. Make no mistake. It's going to take all of us to make a difference. Okay, we're not counting on the federal government, the state government, or county. We're going to count on each other to make this thing work. Right. So this is a community issue. Okay, you gotta get informed. So thank you for coming. Obviously, you guys want to pay attention. You guys want to get informed. So thank you for that. Gotta get informed. Gotta get prepared. And through that, like here, what it says right here, that all of us can help keep us safe. And that's what we need to do. Okay, everybody got to do their part, all right? What we wanted to do too is provide consistent messaging and instruction or training. Okay, we're not making them up because I saw it on social media. How many of you guys have social media? You guys lying, I know already, you guys lying, right? Okay, so a lot of social media, I don't have that, I don't know how to use that thing, but a lot of misinformation that comes out of social media that causes fear. That causes confusion. Okay, so we want to make sure we put out the consistent message from credible sources like the CDC, the Department of Health, the County Civil Defense. That's our goal, consistency. Okay, also another part of our goal is to make sure that we emphasize calm. in the community, that we're not panicking, okay, that we're being organized, okay? But yet, want to make sure that you guys all know, and I'm sure you guys get it because you guys hear, that this is a serious issue, okay? With that, I'd like to turn it over to our Department of Health to start our presentation.
Good evening, and thank you again for coming. And it's really good to see so many people here. I understand that you're concerned, and we hope to answer some of the questions you have, clarify some of your concerns. So let's see. Okay, so as Chief said, this is really a community issue now. It's a global issue, a national issue, and local issue. So it's really a community issue. So be informed and help us keep the community safe. So to begin with, let's just go over with background. Back in December 2019, there was a cluster of pneumonia cases due to at that time unknown virus. These individuals were associated with live animal market in the city of Wuhan, which is in Hubei province in central China. So at that time, this unknown virus, at that time we named it as a novel coronavirus in 2019. Novel meaning it's new at that time, so we called it 2019 nCoV. Yeah. And just to give you additional background on the location here, so the Wuhan is a large city. It has about 8.5 million population in the city. So it's the city that we've never seen in US. We do not have this type of the city in US. Just to kind of give you a comparison, New York City is 8.5. Honolulu is less than 1 million people, right? And then Hubei province is about 58 million or so. So it's the location alone is it's unbelievably big. And imagine how difficult it is to contain if disease outbreak is to happen there. So back in this January 30th, because of the outbreak triggered in China, again in the Hubei province, WHO, World Health Organization, declared international public health emergency. And shortly after that, they decided to rename the disease. So it is now called coronavirus disease in 2019. So now it's COVID-19. They were also able to specifically identify the virus causing the disease. So the virus is called severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. As you may have recall, SARS we've experienced before. So it's very similar and genetically similar, but different strain of SARS virus. So just to give you an update on COVID-19, the World Health Organization reports, well, it is now pandemic. They have declared pandemic recently. So by definition, pandemic means that there is a widespread of disease outbreak in multiple regions, right? Multiple countries. So as you already probably know, we've seen cases in China, big, but then we've seen the cases in other countries, Italy, South Korea, in US as well. So at this point, we are having a pandemic, and then WHO has declared that already. So as of today, there are over 125,000 confirmed cases globally, including 4,600 deaths in over 100 countries and territories. So as you can see, it's widespread at this point. And nationally in US, our own Center for Disease Control and Prevention report, there are over 1,200 cases from 43 states. This is the data from yesterday, so we should have a lot more as of today. So 36 deaths, again, it's probably more than that right now. So when we started seeing the cases in US, they were all associated with the travel-related cases. So meaning that the cases that we saw in US, they were all coming from people who traveled China or people who actually contracted the virus while they were on the cruise ship in Japan, for instance. So we didn't have cases happening in the US in that sense. But today we are seeing a person-to-person transmission in US, and that's also evidence of community spread. So community spread, when we see the case, when we see cases in US, and then we can't even find out the origin of it, we can't trace back to where it came from. That's really evidence of community spread, and that evidence has been seen in multiple states at this point. So this is just to show you how spread the disease has been. The larger the dots, the larger the population affected by COVID-19. And this is for current situation in Hawaii in terms of the numbers of people who are affected by it in state of Hawaii. So we currently have 2 positive cases in Hawaii. This is not a very recent cases. It's been more than a week or so, but we have had 2 cases. Currently, 7 people are under investigation. So they're called person under investigation. Technically, those people are considered high risk, and they are immediately placed on the quarantine, and then also investigated, and then they are getting tested. And 45 have already been tested negative, and then we currently have 27 persons being monitored under DOH supervision. So being monitored means that the person has been determined to have some sort of risk, low or medium risk, not necessarily high risk. So what we are asking these individuals to do is to stay home for 2 weeks, monitor their health, and if nothing else after 2 weeks, you can go back to your normal life. If you feel sick within this period, check with a doctor. So that's the recommendation that we have. But again, these numbers have changed already. Just keep in mind this changes every day. It will look different every day. So just to describe what COVID-19 is. So coronavirus, there are a lot of viruses that are considered coronaviruses. So it's a group of viruses, and some of the coronaviruses actually affect both human and animal. And for some of the viruses that cause disease to us human include common cold, which tend to be mild, usually does not cause severe symptoms, and SARS and MERS, severe acute respiratory syndrome and Middle Eastern respiratory syndrome. Those tend to be very severe and usually have a deadly consequence. And I'm sure some of you have heard of those. And again, some of them affect humans, some of them affect animal. What we know so far for this disease, we think that it was originated from animal and then spread to human through animal market. A lot of things are unknown at this moment, but we are presenting based on what we know from CDC and also what Chinese CDC may have reported to WHO. So just like a flu or just like a cold, the disease is spread through respiratory droplets. So when you cough, when you sneeze, and droplets gets out. So individuals who are in close contact might catch the disease. So close contact can be caregivers, intimate partner, healthcare providers who might have cared for infected person, and then also travelers to or from affected country might be also at risk, obviously. So this is sort of how we want to describe the COVID-19. We know that it's more contagious than seasonal influenza. But at the same time, it's not as contagious as something like smallpox. And in terms of fatality, or you might call it mortality, WHO and Chinese CDC reports about 3.8%. So up to 3 to 4 individual out of 100 may end up dying. So it's nothing to be minimized of. But if we compare COVID-19 fatality based on this with other diseases like flu, obviously it is more deadly than seasonal flu. But then looking at other coronaviruses like SARS and MERS, and then also other very deadly virus like Ebola, definitely less deadly than these things. And in terms of disease severity, this can be a good news depending on who we are talking to. 80% of individuals who were confirmed reported that they only had mild to moderate symptoms. So obviously, a lot of people didn't have to be hospitalized for that matter. Yeah, they could stay home and then recovered while they rested. And other 20% basically had severe symptoms or critical symptoms or conditions that really needed hospitalization or ICU type of care. And you might have heard from media that there were people with who never experienced symptoms of being asymptomatic. But at the same time, so WHO report actually sort of clarifies that most people who initially reported being asymptomatic eventually developed some sort of symptom. So true asymptomatic is unknown and it's still very rare. And I also want to point out that because a lot of people actually did not get very sick, we think that there are a lot of underreported cases. So this mortality or fatality of 3.8%, this is based on what's been reported, confirmed cases. So if we ever add those cases that were never that sick, not very sick, that fatality rate might be actually lower. So it's something to keep in mind. The data changes, and then also the way we look at it is also can also change the number. This is just to have one perspective. So in terms of individuals who might be considered at higher risk, we are definitely talking about elderly population. And so the risk of severity of the disease increases as the person's age also increases. And so remember the fatality we talked about earlier was 3.8%. Based on the same data, you look at it within a certain age group, this goes up to 20%, 21% of 20% fatality among people who are older than the age of 80. Yeah, so so the high-risk population is definitely older group. And then also people with a pre-existing condition or health condition, heart disease, lung disease, diabetes, cancer, HIV positive. These people are also considered to be a high risk as well. They tend to have more severe symptoms or complications. So you do serve elderly, for instance, and then we are definitely concerned about this particular population. So in terms of symptoms, they are just like flu or common cold. You get fever, you can get cough, and you might experience shortness of breath. These symptoms might appear within 2 to 14 days after the exposure. So incubation period is considered 2 to 14 days or 2 weeks. Because some people might experience severe complication symptoms that might mean that pneumonia obviously can develop for some people, and for some cases we've seen death. So the treatment, because it's such a brand new disease, we don't have any specific antiviral treatment just for COVID-19. At the same time, just like flu or just like when you have a cold, we can treat the symptom and relieve the symptom, and then while your body recovers from the disease. And so, so those are the sort of something to keep in mind. No cure, but you can treat it with the symptom. And again, because it's brand new, there are no vaccines available today, and the government, federal government, and the international community are all working on developing new medication and vaccine, but that's going to take a long time. It usually takes up to a year or so or longer. So we are not going to get a cure or vaccine anytime soon. So this just goes back to what federal government has done to contain the disease. So in terms of travelers who came from affected country, like I said earlier, we are asking individuals to stay home for 2 weeks and monitor their health. And this applies to these countries. So CDC has a travel advisories currently in place. And until recently, the country with the highest level warning basically avoid non-essential travel. So CDC equivalent of try not to go or do not go. There were 4 countries at the time until the Europe was added. So it was at that time it was China, South Korea, Iran, and Italy. Today we are including Europe, many countries in this at this point. And allow level 2 in yellow, practice enhanced precautions for the destination. That's Japan right now. So we are recommending, so if you're elderly or if you have health condition, avoid going to Japan. That's the message really. And at this point, over 100 countries are affected or are showing some level of spread of the disease. So no matter where you go, we need to have a precaution. So this is just a little bit about the testing availability. So as of today, we have sort of two places or two segments of testing availability. So we, Department of Health, we have been able to test for COVID-19 since almost a week ago or 2 weeks ago. Our testing is at this point is intended for our ongoing investigation. As of yesterday, private laboratories they have begun testing. So they are now working with your doctor, your private doctor, physicians to offer COVID-19 testing. So physician can see you, and based on your symptoms and then based on your risk factor, they can order the testing without our approval, without Department of Health's approval. So we're asking physicians to use their best judgment to come up with that request. So that means, again, the clinical features, you have fever, do you have cough, do you have sneeze, these things must be present. And then also epidemiological factors are also important. Have you been to affected country in the past 14 days? Or are you a healthcare provider? Have you taken care of somebody with COVID-19? Or are you a caregiver of somebody with COVID-19? Those are considered epidemiological risk factors. And then because Hawaii, we haven't seen community spread. Remember the 2 cases that we had there were travel-related cases. So we know that they didn't contract the virus here. So, the risk of you having COVID-19 right now, right here in Hawaii, is still considered pretty low. So, for instance, right now is a flu season. A lot of people actually have flu. And so physicians should really look into whether you have flu or common cold before making decision to order COVID-19. So now Stacy is gonna take over.
Thank you. So when we're looking at, we know about the disease, we know that it's out there, we know that we can't stop it, but what can we do to help us, in, especially with what you guys do for your life? We want to make sure that we're staying informed and that we have a plan, that we're prepared, and then we protect. And all of that together is going to be a mode of prevention for us. So when we stay informed, we want to make sure that we're relying on reliable resources like the CDC, the Department of Health. We don't want to go to Facebook or Instagram to get our information. That's the key, okay? And we don't want our friends to tell us, my friend said that my other friend, if you do this or if you don't do that, you'll be good. So we want to make sure that we're going to reliable sources. You guys can maybe take a picture of this one too. We have a COVID-19 call center through the county, and the number is here, 935-0031. And that one is open from 7 in the morning till 7 at night. And then you can call your Hawaii District Health Office or the Department of Health after hours number is 211. If you have that burning question and you're like just not sure, then you can go ahead and just call the 211. Okay. So how do we plan and prepare? Well, we want to plan for the possibility of school closures, cancellation of events, travel and activities. So we're already seeing that, right? We're seeing that flights are really cheap right now. People are like, oh, should I jump on it or not? We want to make sure, like, is that travel a good choice for me? Or, we're seeing that a lot of events, such as this, where we would come together in a big group, we're trying to avoid those types of things. But you can see that we took precautions for tonight, where we did the screening process before you guys came in, as well as we're also noting that the virus is not active here in our community right now. So because of that, we're able to have this scenario. But in the future, we would try to do more like web-based learning as well, okay? We want to stock up on prescriptions, making sure that we have enough medications to get through a couple of months, especially if you or your loved one gets quarantined. And then we want to practice social distancing. So you want to think about, they're saying anywhere about 6 to 8 feet. So I want you guys to look at the table that you're sitting at. That table is 6 feet. Okay, so if I was standing at one end of the table talking to somebody at the other end, that's totally out of our norm for culture. But we gotta just change our culture now. We gotta just be a little bit more aware so that we can stay safe and we can keep everybody healthy. So having conversations from this far away so that if somebody were to sneeze or cough, you have a less likely chance of getting those droplets on you, okay? The other thing we're gonna do is we're gonna consider workplace preventative strategies, like doing online meetings, or for some people, it might just be online communication, whether you're gonna use like Facebook Live, Facebook Messenger, you're gonna use FaceTime from the iPhones, you can Skype, doing different ways of communication instead of having that face-to-face being in close quarters. And then last, we want to avoid unnecessary close contact with people. So this is the big one. So I think in a lot of cultures or in a lot of different states, it's not as big of a deal, but because we live in Hawaii, this is our culture, right? You always come up, your kids are, raised that you go in, you honey auntie, you shake uncle's hand. We always have that contact. But we're going to have to start educating that we want to keep that social distance. It is not a disrespect. And I think with the education that we can put out, we're gonna be teaching that it's not disrespectful, it's actually a sign of respect, because we're trying to keep people healthy. When we do our screening, you guys came in, we just asked 3 questions. Have you been sick? Any cough or congestion? Any fever? Okay? And that's it, 3 questions. Was it super uncomfortable when you guys walked through the door? It's probably a little bit different, right? Like, whoa, wait, what? The door's locked, what? But when you guys think about it, if you guys were to do it again and we were to hold another meeting, you'd be like, oh yeah, they're gonna ask me those questions. We've already started to create that as the norm. Okay, the good thing though is that, again, we wanna practice this before it becomes the necessity. So that when it is a necessity, it's just commonplace. Okay, so if you guys are gonna screen family before they come visit, then that's appropriate. And then have them do the hand sanitizer or wash hands before they enter the house or before they go into the rooms to visit family. And then we're gonna protect. So we're gonna wash our hands frequently. We wanna wash our hands as often as we can. If you touch a surface, that's a common surface for everybody to touch. If we're eating, before we're eating, after we're eating, before we use the bathroom, after we use the bathroom, as much as possible, we want to wash our hands because that's how we're most likely spreading it. The chief mentioned earlier, we touch our face about 90 times a day. Think about that. Everybody's like, ah. We touch our face about 90 times a day, and if you think about, if you touch this surface that wasn't disinfected, it wasn't clean, your hand is dirty, and then you're like, oh, I think I got something stuck in my tooth, and you're digging at your tooth, you've just given yourself those germs, okay? We want to avoid touching our face, our eyes, our nose, our mouth. And we want to avoid close contact with sick people. So again, that's social distancing. Right? So instead of going to Target every day, we're going to go to Target once a week. We're going to just stock up, do very responsible shopping or outings that are responsible, where we have a pre-plan. And then if we are ill, we want to stay home. We don't need to be going out into public. So this is twofold. A lot of people are thinking, oh, if you're sick, you have to stay home for 2 weeks, you have to quarantine because you could have the COVID-19. Well, not only that, but you have to also think about that this virus is going to attack mostly the elderly, right? And the people who are fragile medically. So if we're going out there and we're spreading just a regular virus, the common cold or the flu, we're already compromising other people's immune systems. So we want to keep our community safe as well. If you're sick, stay home. We want to cover our cough and our sneeze. My little ones are the worst at this, the little ones, yeah? The preschoolers, ha-choo, they want to see how big it is, how big is their sneeze. But you want to teach them and also yourself. Cover your cough, cover your sneeze, and then if you use your hands, what are we going to do? Wash our hands right after. And you can have that hand sanitizer available, use the hand sanitizer, and when you have the opportunity, wash your hands with soap and water. Remember when you guys are washing, you want to sing the ABC song, Happy Birthday 2 times. You should get that soap, let it marinate on those hands for a good 20 seconds at least. And the last thing we want to do is we want to clean and disinfect often. So how many people have been shopping lately? No toilet paper? No. Okay, so we're also starting to see a decline in other things like the Clorox wipes, right? And that's what you guys have been recommended to disinfect and clean with. Well, we also have over here just a regular Clorox bleach. It's just household bleach here. You guys can mix that into a gallon jug of water. Okay, you can use a third cup of bleach to this water, let it sit, and then you can put that into a spray bottle and you can use that for disinfecting, okay? The other thing you can do is you can use a spray bottle about the size of a quart, and you're gonna put 4 teaspoons. Oh, sorry, I jumped the slide. You're gonna put 4 teaspoons in here, okay? And generally speaking, this is a bleach solution that we use in many places to do disinfecting. I've seen this done in preschools, and it will kill most germs. Now, does it specifically kill COVID-19? Well, it does kill coronavirus, this very, very specific one, most possibly. But if you could not use anything, or you could use a bleach solution, what would you vote for? Use the bleach solution, very good. And then we also want to make sure that we're targeting our frequently touched surfaces. So we've had over 100 people come through here, and after each group, we wiped down all of these tables, we wiped down the chairs. Pretty simple. We had 3 or 4 of us, we were able to tack it, it's done in 5 minutes. Okay, so think about the places that are most commonly used, commonly touched, those surfaces, those are the ones you guys want to make sure that you're touching with the bleach, okay? So when we're disinfecting, we want to make sure that we use gloves. Remember, you guys are going to be washing your hands often. Your people are telling me their hands are drying out. You can use lotion too, but you want to use gloves, especially with these types of products. You're going to follow instructions listed on the products if you're using a product such as the Clorox wipes or any other disinfectant over the counter. And then for your bleach mixture, we want to spray it onto the surface and let it sit for 3 to 5 minutes. We want it to do some work. And then we're going to wipe it dry with a paper towel. And then what do you think you do after that? You're like, oh, I got a little bit of bleach on my hands, it's all good. No, you got to wash them with soap and water. Okay, this mixture will sit for about 2 to 3 weeks, and then you're going to want to change it out if you haven't gone through it already. Okay? So what do you do if you're sick? Well, if you have flu-like symptoms, then contact your primary care physician. Okay, immediately now we've got this kind of panic in the community where people are like, oh my gosh, I'm sniffling, I have COVID-19. And they want a test. I want to demand a test right now. How come I can't get a test? Well, like we said earlier, the flu is really common right now. So you want to check with your PCP, okay? You want to find out, what do they want you to do? They're going to ask you some questions. Don't just walk into their office, okay? Because they're going to want you to kind of self-regulate yourself as much as you can before you come to a doctor's office where there might be fragile people or sick people, and then you bring something to their office. So call your PCP, and if you don't have a PCP, then call your local community health clinic. So that would be like an urgent care, okay? And if you don't have insurance, then you would want to call a federally qualified health center such as a faith clinic. But here's the thing, if you are having difficulty breathing and you feel like it's serious, don't think, oh, that's all right, I don't want to bother anybody. Then it's okay to call. It's okay to call 911, and it's okay to have us come pick you up and take you to the hospital. But when you do that, you want to let the dispatcher know that you have flu-like symptoms or that you're having difficulty breathing. Okay, or that your client is having difficulty breathing, because that's going to allow us to put our PPE on before we come into the house to pick them up. Okay, so again, it's about that forward thinking. It's about making that decision to let us know all the details when you call 911, so that not only can you keep yourself safe, you're getting care for your client, but you're also keeping us safe, so that we can continue to respond to more and more calls. Okay, so again, community prevention strategies, again, we have social distancing. Remember that 6 feet, that's kind of far. It's kind of far, but that's gonna keep you from being in that range of those droplets when anybody sneezes or coughs. When you're sick, stay home. And then there might be some new workplace policies that are developed. Maybe we start a screening. Maybe before you come in the house, you gotta hand sanitize. Maybe we gotta wash often when we come in and when we leave. Okay, you might start some new workplace policies for yourself. And then we wanna do our personal preventative measures. Stay healthy. Make decisions that keep you healthy. And then we wanna increase our public health education. So when you want updated information on COVID-19, these are the websites we're gonna go to. Again, it's the same one we had earlier, But remember, this thing is changing every single day. Every single day, we're getting more and more information. It's changing between 7 o'clock in the morning and 7 o'clock at night. So keep yourself educated and make sure when you are keeping yourself educated, you're going to the right sites. And then if you want, you can also log on to our Hawaii County website, go to the Civil Defense Agency tab, and you can sign up for our automatic alerts, and they'll send you a text message. And they'll send you an email to let you know what the latest updates are as far as the county is concerned. We're swapping here.
And so, as a result of this incident, there is a joint information center that has been set up on Oahu. A lot of state agencies are partnering with the county to get information out. A really good thing about this is it's updated on the daily. You go to our website, health.hawaii.gov. If you scroll down a little bit more, there's a red box below here. It says, put your email in here if you want to receive updates. You click on that link, put your email in. This is going to be delivered into your inbox every day, usually about 4, 5, 6 in the afternoon, with all of those updates. So you can stay connected. So we will deliver that to you if you want it that way. And if you forget, health.hawaii.gov, I know some people are still taking pictures. While I have you though, how many of you are arch operators? Almost everybody? The other operators, you have foster care home? Yeah, so we're a mixed group, yeah. I know with the arch group operators, as part of the licensing, you submit an infection control plan, right? And the foster care homes have a similar, yeah? Yep, this is the time to review those plans. Right, so you have these plans in there. You know, if you haven't looked at them, dust them off, take them off the shelf, look at it. Right, a lot of the same guidance that would apply to any infectious disease, especially a respiratory illness, right, is going to apply here. So review that existing plan, right? If you have to put someone in an isolation kind of room or a room that's away from people because they're sick, we don't know if it's COVID yet. You don't know if it's COVID yet. They're coughing. Maybe that's the place to put them, right? Educate your residents, your staff, your visitors, right? You may want to just, remind everybody coming over to, if you're sick, especially if you're exhibiting a cough at this time, maybe now's not the time to visit. Keep a good check on your employees if they're sick. If you have family members coming over too, that's something to consider as well. So think about what you can do to make sure that anybody that comes in to your site is not going to bring anything in that you don't want as well. So this is all going to really help, and the good thing is you probably already know about this, right? Because you care about the health of your residents, whether it's COVID, seasonal influenza, or anything else out there. So think about your staff, think about those policies and procedures as visitors come in. And you know your residents best, right? You know their health, you know their history, you have those indications. If someone usually gets sick, what do you usually do? What are those processes? How would this situation affect that process, right? We've told you today, if you're sick, call ahead. They have insurance, it'd be Kaiser, right? They have a nurse on standby who can answer questions and say, what should I do? Especially if it's on a weekend and you're determining if you want to call urgent care or call or determine if you have to go to the emergency room, right? So use those options to determine what's appropriate. You know your residents best. And as for activities that you might do, if you have very mobile residents going out, consider that. If you want to limit it, if you want to change how you operate that way, but it's the same thing applies for them, right? Especially, we have no evidence of community transmission at this time, but that's something to consider just in general for keeping your folks healthy. So what would happen then, right, if we start having community spread? What does this mean for you, right? These plans that you have, these policies might become even more important. So what happens if you suspect one of your residents might have it, right? as Department of Health, we certainly want to know, right? With every single case of potential person under investigation, there's always, you're going to meet a certain criteria to be tested, to be assessed. And as soon as that happens, it starts a cascade of events. One of our disease investigation folks are going to contact you. They might want to know, well, who else is living in there? Are they having symptoms, right? Who works there? Who takes care of them? Who might have visited at that time in the last 14 days? So we're using that 14-day window of that time of exposure. So if you keep logs of visitors who comes in, that might help us, right? If you keep good logs of who was working on certain days, that's going to help us our investigation too. If you have those controls already in place, you're running probably a pretty solid home already. So if you have those things and you suspect that people are sick, obviously if it's a medical emergency, you know what you're going to have to do, right? If someone is having mild symptoms and you're like, okay, well, what should I do? Well, you might want to call ahead to the primary care physician, say, these are the symptoms, should we come in? They might say, let's assess them over the phone and see what's going on, determine it. A lot of providers are very sensitive, right? In this situation too, if we have community spread, they're going to be very sensitive about bringing patients in there. So, we don't want to crash our emergency system just because someone is exhibiting a cough. Because as Yoshi had mentioned, a lot of people will get this disease. Some of those symptoms will be mild, but in terms of your residents, right, because of their age and what we're seeing about this disease, the morbidity in that age group might be a lot higher. So we want to make sure that we're on top of this and we have those controls. We have a disease reporting line. We can support questions of that nature. That disease reporting is usually done by physicians notifying us. Okay, so I want to make sure that you're going to your medical care provider that you have in your plans already to make sure that that's the access point to get tested, to get care, and to get guidance. Okay, if you have questions about your infection control plan, there is a great guidance. I know it's down here. Just remember cdc.gov. You're going to see coronavirus everywhere on that page. Click on it. There's what's called interim guidance for taking care of patients in a residential setting, right? So there is already some of those things already. If your facility has other people there, right? Think about it. If a person becomes under suspicion in your care and there's other residents there, they might have been already exposed. There's a good chance they've already been exposed. So we're going to have to start investigations on them. And if there are any visitors to come up to visit them, we're going to have to ask that question as well. So even though you may have one sick person, by the time you find out that sick person, those other ones could have already been exposed because of the incubation phase of this period. So if someone certainly is not able to maintain their health in that facility, it may be time to consider transferring that patient out. If you can imagine, this is a really, really hard scenario because at this time we've already have community transmission going on. Our emergency rooms are going to be very, very busy. A lot of people are going to be panicking and thinking they have it. So make sure you've thought about this early on. As we've also mentioned, there is a chance that a good portion of people who get the disease will have mild symptoms. And at some points, even if they're admitted into a hospital, they might be discharged as well. Hopefully they're kept at the hospital beyond the 14 days. And they're no longer contagious, so they can return home. For others, the most comfortable place may be to stay at home. However, your home has to be a suitable place so that additional people are not getting at risk, including yourselves, workers, and other residents. So these things, may not apply if you're not able to keep that level of care, right? And so this is certainly, if we consider the nature of this disease, right? It's a novel coronavirus. All of us are equally susceptible. All of us can get it because we've never had it before. Brand new, it's novel. So there's no immunity in the general population for this disease. Whether you're young, you're old, rich, poor, homeless, none of us have that immunity. So the concern then is to, how do we take care of these people, right? If you're not able to take care of them, they might be admitted to the hospital. The hospital's very, very busy. They're seeking they have very, very sick people. These are solutions that we have to work with, and maybe we can also tap into your resources to let us know what those best options are as well. But these are things that you should be considering already. We don't know the full magnitude of what the situation is going to be, but you know, we're hoping that if we jump on the cases as soon as they come, that we're able to push, if we can put out these little fires and we know who got sick and we can know who might have been working with them or seeing them during their infectious stage, then we can slow down this disease and not have a widespread community planning. So a lot of public health is before the disease, yeah? This is high-level medical care. No one wants to see this scenario. It's going to be very, very busy. But you have to think about your capabilities and what you're able to do. And that's why that prevention, right? That infection control plan, that visiting your visiting plans and what kind of activities you do, even your own personal protection plan, right? You know, do you start it now? What do you do? These are things that we want you to think about right now. Because we aren't there yet. And we hope we never get there. But this now is the time to start planning. And the good news is your planning that you're putting in now is going to help your plan be better in the future, right? And you're going to be better prepared for what may come down the line. This hope we've talked about this disease, and you know it's as I said, it's novel, it's new, but a lot of, as you can see, it's a lot of that universal precautions, gloves, surgical masks, maybe putting on, if you have sick patients, immediately put a surgical mask on that person and start triaging them out. Are they sick enough to stay? Let me call the doctor. Let me see what the history. What does the doctor recommend? Is it transferring out? Should someone come out? Are you going to call EMS? You know, these are all decisions that should be made. You should have a tiered plan to tell you at what point you need to make that next step. So all we're asking you certainly is to do that. You have a very, very big responsibility that you carry 24/7. I commend you for all the work that you do. You provide a very critical service for a lot of residents on this island, so I thank you. I think in terms of our slides and presentation, I know that was a lot to take in. We want to make sure that this is a conversation as well. We want to hear what questions you may have, what concerns you may have. I'll be honest, we have some answers. We may not have all the answers. It's a very dynamic situation. But we also want to hear from you, right?
I have a question for Ed.
Yes.
So you guys kind of just ask, or they ask you guys a question. So how many of you guys are allowing visitors in your facilities now? Okay. So, I mean, in doing so, how many of you guys doing screening of those visitors? Terrific. Terrific. How many of you guys plan to do screening now? Okay, everybody should, right? Okay. And then let me ask you another question then. What if the advice, or it came highly recommended that we just stop visitors right now? Would that be totally, like, not doable? Is that doable? Okay, good. That's what I just wanted to hear that. Thank you. Any questions for Jason?
But is that particularly healthy to say no visitors, right? Would the residents be happy? Would the residents' families be happy? Or they would understand? That's great. So what I love about hearing that, it's a very confident answer. It means you have a great relationship with the families, and everyone understands it, because this is a public health problem. It's kind of everyone's kuleana, right? So we're asking you to do your part for yourself, for your families, but also for your residents as well. So, yes.
Are we following 14 days?
Are we following?
Visitors to not come in?
You mean 14 days from today? So the question is, are we going from 14 days or no visitors from today? You know, that's, to be honest, this situation could last for quite some time. Now's the time to start reviewing that plan and digging in your heels, because quite frankly, we do not know when this could end. It's not like 14 days from here, we're going to be in a better place. As long as there's community transmission and people who can get the disease, and as I said, we've got a global population that is susceptible to this disease, there will be more transmission. And case counts in the US will go higher as more people get tested. our strategy certainly, and we're unique here, right? We may be the best place to deal with this because we're in the middle of the Pacific. And already flights are being canceled. Not a lot of people are flying. There's no Princess Cruises coming in now for the next 30 days. Less people are going to be coming in, so less introduction. If we can slow that down enough, but we're also very isolated out here. And to the effect of people hoarding, I know it's not just toilet paper, right? Anyone try to buy this?
Yeah.
Yeah? No, don't steal ours, but that's the natural tendency. There is no evidence that this, unlike a earthquake, we tell you to get prepared for things like that, right? Earthquake, and we say like, what are you gonna do if you need emergency power? You need a generator? This is not that kind of scenario. We don't think there's gonna be any impact to our water supply, our electrical supply, and we've gotten commitments from Matsons that they do not anticipate any slowing of ships coming across from a logistics standpoint to bring in our supplies. So I know it's hard to find toilet paper right now. Someone's making a lot of money.
Yeah.
My wife has a lot of toilet paper. I shouldn't say that because you might come to my house, but it's, and I tried to talk her down, but then she's doing it for the rest of my family, so it's okay because we're the place to come now. We're the supply chain. But that's the natural human behavior. Try to realize this is going to be something long. We don't anticipate any of that. Some of that supply is just because it's just not getting out and they're reserving it for people that need it the most. And that's primarily our frontline defenses, our first responders, and our healthcare workers. So don't buy into that impulse, right? See what you have already on your stock. And I know people are talking about sanitizer, but I haven't seen any soap sell out yet, right? And for your facilities, you usually have a sink with soap already. So that's nice. Stick to the soap and water. I don't think we're going to be running out of that anytime soon.
Can you confirm the use of masks?
Can you
Confirm the use of masks?
can you confirm the use of masks?
So you folks said masks and gloves. I heard that the surgical masks do not protect somebody from getting.
That's right, and there's a lot of guidance from the CDC for the general population to not use masks. However, the use of masks in this scenario would be like if you notice someone coughing, right? We don't know if it's COVID, it could be flu, it could be anything. If it's respiratory, I want to put a surgical mask on the person that's sick anyways to kind of make a physical barrier so those droplets are less likely to get out. So does it capture blood droplets? Yes. Will some of it get through? We don't know the full. An N95 respirator is going to be a much tighter fit. But we're talking about people that we don't know what their disposition is, right? We don't know if they're sick. So if you have a resident who's sick, we don't know if they're a person under investigation yet. We should put a mask on that person, and then you can go start triaging from there. Just in an abundance of
But
caution.
it's not going to help. It's not going to alleviate somebody with the virus. It's
Well,
not going to stop that, right?
Well, it's going to stop some of it, right? But we don't know what it is at that point. If we were in a medical facility and we had a closed environment in an isolated facility, and I was a healthcare worker working on a person that I know has this disease or has a high likelihood of this disease, that's when I use, either you could use an N95 if you wanted to use that. They're also using PAPRs. Those are those bubble suits with the air purifying respirator that goes in, so you're not even breathing any of that air. But that's for people who are confirmed when you're working with it. The idea is if you had a person with COVID in your household, right? If you were taking care of a person, that would be very challenging in a residential home. Because just having that home, if you have other residents nearby, they're in common eating areas, they're using the common bathroom, and you're probably not going to find yourself in that situation. And especially with your age cohort, they already might be admitted into the hospital already, right? That's probably a better place for them. So I don't really anticipate the burden being put necessarily on you guys to deal with mild cases. Well, we don't want to prevent that. We don't even want to get to that point, right? So if this is going around town, the only way your residents are going to get it if they're not leaving is how? Who's going to bring it into your home? Was that
Family.
family, your employees, maybe even yourself? So you guys are the prevention frontline. You don't want to bring it in. It might be going on in the community, but because of the transmission, you know, the face-to-face contact, if your residents aren't really leaving home, they're not likely to get it unless they're interacting with someone who left the home. And they're not the ones leaving the home, right? It's everybody else. So that's where you want to start that prevention. But yes, the gloves, or I'm sorry, not the gloves, the masks. Yes, general population, just for preventing you getting sick, not going to help. Putting a mask on a sick person is the best thing you can do if you don't know what their status is. If someone has COVID-19, there probably is not the best place to put them next to others that haven't been exposed yet. So I would not put a mask on someone in general. I put them in a better setting so they don't infect someone.
That's something I know, but I'm still trying to get clarification. If somebody has that disease, the standard surgical mask is not or is going to stop that transmission.
It helps in terms of spread of the droplet, right? It goes
But
like
it's
this.
not
By
going-
doing the math, it's stopping it. So that's why it's effective. Prevent it to others, right? It prevents from being spreading the
Because
droplet.
I thought the CDC said it's don't use masks, it's not gonna help.
For the general
Yeah,
public.
that's what I'm thinking.
Don't, you know, I think there's a lot of pictures you're seeing in Asia of people walking around town with a mask. That's what they're trying to prevent is the US public going out, and good luck trying to get those masks right now. They're very hard to get, like an N95 particulate respirator and higher. Those are incredibly hard to find these days because the limited supply is going to also first responders and healthcare workers because there is that hoarding. So that guidance is mainly guided towards the general public. However, the guidance for healthcare workers in a healthcare setting are to use N95s unless you don't have any. Then the best you can do is a surgical. That's right. But people constantly think I need one on me because I'm not sick. It's better putting on someone who is sick. So, you know, and for your population too, if somebody also has, you know, complications breathing, if they're having, if they're not a good, if they're having respiratory problems, that's just part of their chronic health. Do you want to put a mask on them? No. So, you know, that's something to be concerned about as well. Putting masks on your patients for X amount of hours a day, probably not a good idea, right? And that's why even, you know, when we, from a employee standpoint, or from a working standpoint, like our fire team, when they get fit tested for an N95, medical grade respirators, you know, that's, you know, there's a lot of testing for that to make sure that it fits the contours, that they know how to take it on and off properly. That if there is virus on the face of that, because I have been interacting with a COVID patient, I don't touch it with my hands, and then touch my pocket, take it off like this, and then touch my face. You know, these are things to reduce that infection control around a positive COVID patient. It takes a lot of practice and a lot of support and a lot of personal protection equipment. So we don't want to find ourselves in that situation. And especially, that's going to be a load on you guys that you guys don't want to deal with either. So don't introduce it into your population in general. This is where that prevention is really going to help not only you, but also the general public. Yeah. Any other comments? Oh, go ahead.
Is it possible for all the doctors to be tested too?
Is it possible for all the doctors to be tested?
Because sometimes they come when you bring our.
Yeah. And you know, you bring up a good point. You know, I'm guilty of it. Sometimes, you know, I have 3 little ones. I get sick. They like to sleep next to me and cough in my face. And then sometimes I'm not feeling the best. So I say, you know, I'm not feeling the best, but I got to do something at work. I'm just going to go in anyways. And you know, what we learn even in kindergarten as young kids about washing our hands, not drinking from the same cup, staying home when we're sick. You know, very basic messaging, but sometimes our world is so complicated we forget those things, how important they are, and why we teach children that. Children have a problem of getting too close to people in general, and maybe that's why.
Wash their hands for one another.
Yeah. So you're right. Everybody has to practice these things. Whether you're a doctor, the president, the governor, this virus doesn't care if you're a politician, a CEO, or yeah. So remember that you're right. They should be washing their hands. They should not be coming to work when they're sick. And everybody has to follow this from the bottom to the top. Becca, did you have a question? Okay. That's it. We'll be around too. There's a lot of some paper guidance over there for you guys to do it. Make sure you sign up for the Joint Information Center messaging so to keep updates coming to you. And stay connected. I told them 3 things I want you to take away. I know you had a lot of information. Number 1, this is really, really important. Number 2, make sure you're getting information from a credible source. So get the right information. And number 3, stay tuned. Things are going to change. So thank you. Good evening. We'll be around more. I want to thank everybody for coming.
We go on that door too, if you guys want.
I don't know. I mean, you can.